Well, I am joined today by Dr. Paul Osteen, and I got to tell you, I'm a fan of your brother, so I'm biased here. And I've met him before, and so it's an honor just to be here with you. And I got to tell you, you're talking about something that's very important to my heart, and that's missions.
Yeah.
And so it's one of those things where I served as a missions pastor for a number of years, and so I get it, Dr. Osteen, if that makes sense. So I got to ask you this question because everybody's going to want to know this question. So we'll just get it out of the way. What's it like being Joel Osteen's brother?
Well, that's a great question. He is just the most normal guy you've ever met. He's the most humble guy you've ever met. He's the sweetest guy you've ever met. So he's not any different than he was when he was 8 years old or 17 years old, despite all the fame, despite all the accolades. He's just the same guy. So he's just a great guy. And it's it's an honor to be associated with him. He's just a good guy.
I love his ministry and heart, man. The M3 conference that's coming up, man.
Right.
I gotta tell you, when I got this information, a little bit of me jumped up on the inside. That was like, man, mobilization, medical, and missions. I know how to do 2 out of the 3, but you know how to do all 3. Where did this heart for missions come from?
Well, my heart for missions came from my dad. We grew up in a pastor's home, and there were 3 things that our church was built on. That is worshiping God, teaching the world, and evangelizing the world. So ever since I was a little boy, we would have these mission conferences every Thanksgiving, and missionaries from all over the world would come. And pretty soon after years and years and years of that, they became part of our family. And so we just grew up with a heart for missions and for the local people who are doing missions, and we supported them, and Daddy went over there and he ministered to them, and he just planted that heart in every one of us as his kids. So I would say that's where it all started, and I'm just really blessed to have that heritage.
Wow. I've never seen a conference like this before. Like usually they're doing 1 of the 3 or 2 of the 3.
Right.
When did you know, or better yet, where were you at when you sensed God go, okay, I want you to pull together this conference?
Well, that is a great question. I can tell you an exact answer to that. Let me just give you a little preface. For the last 17 years, I've been spending 4 to 6 months a year in rural mission hospitals, mostly in sub-Saharan Africa. And so we're out with the poor and often forgotten and overlooked people who often have little access to health care. But to answer your question, I was out at a little mission hospital called Chitokoloki near Angola and Congo in Zambia. And I'd been working there 3.5 months. And so I was the only surgeon there. And when I finished, I went back to Lusaka, the capital of Zambia. And when I was there, one of the surgeons who was in Lusaka said, "Paul, do you realize that for the past 3.5 months, you were the only surgeon in an area the size of Louisiana?" And that hit me, because all of a sudden I realized how big Louisiana is and how far-reaching the people would need access to surgical care and would have very little access to surgical care. And specifically, Maina, what I thought about was that little girl, 15 years old, pregnant, needs a C-section, and she lives 4 days away from a hospital. Yeah. How's she going to get to you in time to save her life and save the baby's life? So anyway, I had that realization. I was the only qualified surgeon in a state the size of Louisiana. And I flew back into Houston 36 hours later, and we have the largest medical center in the world here. Yeah. There are 2,500 doctors in one zip code here. And so God just put it on my heart. Why not take the surplus that's in America and combine it with the lack that we have in many, many parts of the world? And that's the genesis behind the M3 Missions Conference, the Mobilizing Medical Missions Conference.
I got to tell you, when I was looking at the list of people who are going to be there, it was one of those things, and I know you get to see this almost every year. You guys took a couple of years off because of COVID, and I know you may be used to it, Dr. Osteen, but when I saw it, I was like, wow, I want to be a part of that just because it brings everyone together underneath one roof who can make a difference, Dr. Osteen,
Yeah, I agree with that. And really, there's three things that we really try to emphasize when we birth this conference. And that is, number one, give people a place to connect. people who have a passion for missions and for medical missions, give them a platform and a stage where they could connect with each other. Secondly, let them be inspired as they hear from men and women from all around the world. And just as you said, these people are amazing people doing amazing works all around the world. I put it like this: they're knee-deep, fingernails dirty, doing the work of medical missions all around the world. So let people be inspired. And then third, all around the bowl of our big church, we have exhibitors, mission organizations that need volunteers to help them. So we pray the third part is that you would find your mission, find ways that you can be involved. So that's kind of the in a nutshell, the M3 conference.
Now, I'll put you on the spot here. I wasn't meaning to do this, but I've got to ask this question because your dad has such a missions heart. Man.
Right.
Like he would go everywhere, in fact. What do you think he would say of this conference, Dr. Osteen? I mean, wow.
I think it would warm his heart.
Yeah.
I think it would warm his heart. I think it would warm his heart seeing, what Joel's doing with, the television evangelism, reaching people all over the world. But I think this would warm his heart too, that we're continuing his legacy of reaching the world with the gospel.
I would agree because he was such an incredible man at doing that well.
I appreciate that.
All right, you had a second act here. I mean, and I know a little bit of what that is like. Before I got into this lane of journalism, I was a missions pastor on staff at a church. Yeah. At 41, God goes, "Okay, we're going to do a second act." Yeah.
Yeah.
You have done that well too, because you were, you still are a doctor and a surgeon, but then God moved you into the ministry also. Yeah. Can you explain that to me of how that's worked out?
Yeah, it was an amazing thing. I'll give you the 3-minute edition. For years I practiced general and vascular surgery in Little Rock, Arkansas. I had a great practice. I had great partners. I had a great church. I was involved in the church. They called me a surgeon pastor because of the way I took care of people there. And anyway, I thought I was going to be there for the rest of my life. A couple of years before we made the move, I developed this unrest in my heart. I didn't know what it was at first. I thought maybe I was burned out. I thought maybe I was, having a midlife crisis. I really wasn't sure what it was. But then I began to realize, Maina, that it was a spiritual issue. He was lifting the cloud, so to speak, lifting the pillar of fire, but he hadn't given me a direction to go. So I just kept doing what I was doing, practicing surgery to the best of my ability. My dad taught us, keep doing the last thing God told you to do until he clearly tells you the next thing to do. So we kept doing that. My dad suddenly died of heart disease and of a stroke. And driving home from his memorial service, I heard 3 sentences in my heart: give up your practice, move to Houston, and help at the church however you're needed. And you know what? It made no sense to this surgeon brain of mine, but it made perfect sense to my heart because that's what I had been missing, clear direction from the Lord. So you know what? We moved to Houston to help Joel. We didn't even know Joel's going to be the pastor at the time, but moved eventually to Houston to help Joel and my sister and my mom at the church. And then out of that, God birthed the ability for me to use my gifts in surgery and to go overseas to do medical missions work and missionary surgery work all around the world. So I don't know of a better way to combine what I had, my passion for missions with my love for surgery. And you know what? I get to do it now, and you do it for people who really, really need it, and it is extremely rewarding.
Paul, I can tell when I'm watching you either preach or, talk about this stuff, that it just ignites, something inside you just gets ignited about this, man. And so I got to ask this question: when the conference is over and done, I'm sure you go home and take a nap, obviously, because it's over. You spent a lot of time on this. What happens to you when you see all that God has done in this 3-day, or God's going to do in this 3-day window, man?
Well, I just sit back and I'm just thankful, because invariably we'll hear stories of, I came to the conference 3 years ago and all of a sudden now I'm in Mombasa, Kenya, or I came to the conference 3 years ago and God birthed this in my heart. So I think those stories of how God's mobilizing his people, that's what kind of energizes me. And so it's kind of hard to sleep after the conference because I'm excited about what's God's doing in and through the conference.
What do you think God's going to, this is so hard. I did not want to ask this question, and I've like worked with the words over and over again, Dr. Osteen, so forgive me here. What do you expect God to do this year at the conference?
Well, that is a great question. the theme of this conference, and you'll appreciate this being a missions pastor, is to reach the unreached.
Mm.
There's 3 billion people in this world that have no solid gospel representation in their lives or in their countries or in their regions of the world. Mostly the 1040 window, many areas of the country that are, areas of the world that are very difficult to work in. And so we're hoping that our speakers who come from Afghanistan and Nepal and Bhutan and northern India called Bihar and very difficult to work areas in North Africa I can't even mention. I'm just praying that God would birth in people's hearts the realization that we live in a Christian nation, or maybe post-Christian now, but we live where the gospel is very well known. But a lot of people don't have access to the gospel. And that should stir our hearts, it should burden our hearts, and it should challenge us to do what we can do to reach those people with the gospel. And let me just say, many of those countries are closed to traditional missionaries, but you can get in if you're in IT or if you're in medicine or if you're in, you're a mechanic or in fields like that, leadership fields. So there are opportunities to make a difference in those areas of the world using the gifts and talents and training that God's given us.
I got to tell you, Dr. Osteen, the word that the Lord gave me this year is access. That not a lot of folks don't have access. You know, and when you think about that, it does something inside of my own personal heart. Next, the last question here, Dr. Osteen. When you look back to the first mission trip that you went on with your dad, to what you're doing now, what comes to mind?
Can I tell you a story about that? Because this is a really, really neat story. I was 12 years old and my dad took me to South Africa with him. And we flew from Madrid down to South Africa to Johannesburg. And midway, we had to stop and refuel, or not midway, a little past midway. And I remember, Maina, when I got off the airplane to refuel, I could feel the tar, how hot it was, as on the tarmac there. And I had this overwhelming impression that I was going to be back one day in Africa as a missionary. I was 12 years old. Well, I just buried that inside of my heart. 44 years later, and let me say this too, that particular country we landed in, best I remember, was Northern Rhodesia. So when 44 years later, I'm working at a remote mission hospital and I open a book, and in that book, I realized that the name of the hospital, the name of the country had changed from Northern Rhodesia to Zambia. I was in the exact country that God had planted that in my heart 44 years before. So what comes from that first mission trip is that God weaves it all together like he wants to weave it together. And if he said something to you, if he whispered something into your heart as a young child or as an adult or as a 40-year-old or as a 60-year-old, you know what? He is well able to bring that to pass in his time.
Wow, you're going to tear me up here. Thank you, Dr. Osteen. Your brother didn't get nearly, I don't get teared up around him. I'm joking, man. That's a powerful story. Last question, man. When you're in the midst of it and God is just moving and things are happening, what do you sense that God is doing during that time? And I know it's hard for you to get in everybody's life who's at the conference, but what do you hear? What do you sense?
Well, I can tell you what I sense spiritually is that people's hearts are just open. You can just feel that they're open, they're being touched, they're being challenged. And so I would say that would be the number one thing that I sense, that people have just this incredible openness to God. Use me wherever you want to use me. Make me, mold me, fill me, and use me. And I feel like that's what happens at the conference. Their people's hearts are open to whatever God would have for them. And I think so many people take that next bold step to the next thing God calls them to do. It may be a baby step, it may be a big step, but I feel like people are right on the edge of taking the next step to be involved in global missions.
Well, I got to tell you, this has been fun, and I can't believe our time is up, and I just thank you just for what God's going to do in February, and I thank you for being able to pivot well to wherever God calls you to next. I mean, as I was reading your story here last night, I said, what a great example of how God always gives second acts if we're listening to him.
Listen, I wish you many blessings on UrbanFaith and everything you guys have put your hands to do. I pray it prosper and succeed exceedingly abundantly above anything you could ask, think, or imagine.
Man, I appreciate that. Thank you. Have a great conference.
All right. Blessings, man.
I'll be praying.
All right. Thank you. Bye-bye.